go. Hi everyone, and welcome to the webinar tonight. We're just going to wait another minute or two before we just kick it off, just waiting for everyone to join up. This is the nice part, watching all the numbers fly in. So yeah, just wait a few more minutes. Right, okay, I think we'll just start to kick it off now. So my name's Aoife and I'm the marketing manager for Sims and Rotunda IVF. So I'm going to mostly be just in the background and just answering any kind of, what I'd encourage people to do is just, if you have any questions throughout, just pop it into the Q&A. There's a little Q&A at the bottom there. And if there's any things I can answer, I will. And if there's any kind of specific questions for Helga, Helga will answer those at the end after her presentation. So yeah, I'll just pop off now myself and I'll let Helga take over. Okay.
Okay. Thanks a million, Aoife. As you know, I'm Helga. I'm in fertility for a long time, about 18 years now. So it's a long time. So I have a good idea of what it's like and what it's about. So, so what I'm going to do is I have a few slides that I'm going to just show you that you can see. But I'll just talk about the effects first and then go into self-care. I know probably there'll be a few questions. I have a few questions already that we will concentrate on afterwards, if that's okay. So we start off with anyway, yeah, this is me. This is the mental health. This is a road that I don't think needs any explanation or any words to describe it. So I'll just move on from there, the long windy road of fertility. As I said, we're going to talk about the effects and the self-care then afterwards, which is just as important, if not more. So the effects, these are the effects I feel of fertility on the mental health. You've got grief and loss, communication, low self-esteem. And I'm going to touch on women versus men and fertility. I know we have a lot of same-sex couples and single people that come on the program, but I just wanted to touch on how fertility can affect men as well. So we'll start off then with, this picture, which also needs no introduction at all, the roller coaster of emotions that you have going through the program. So grief and loss. What I want to say about grief and loss is that some couples that go through fertility and have unsuccessful cycles or are trying hard even before they get on the program, and they don't realize that they do have feelings of grief and loss. And it's like a bereavement. It's the loss of the potential. It's the every month getting a period when you're trying at home yourselves. And, you know, it's just the roller coaster of emotions. Every cycle when it doesn't work. It's like miscarriage as well, which is so much, it's huge as well. That people don't really understand that miscarriage, even though you don't have anything to show for the end, it still feels the same. So it's about not minimizing the feelings that you have, that realize that they are important and they're huge, okay. Also, I'm going to talk about communication. And that's with like family and friends and the workplace, which are huge parts of fertility treatment as well. Like with family and friends, like do I tell my family and friends? Do I not tell them? If I do tell them, what do I tell them? Do I tell them a bit? Do I tell them a lot? Will they ask me loads of questions if I give a lot, if I have, you know, a lot to say? Will they say the wrong thing? We did a thing a couple of months ago on kind words, which I will touch on a bit here because I think it's just important, because family and friends and people around you just always sometimes don't know what it's like to go through this. They have no understanding of it. So I think it's important to bring that up as well. And that brings me on to the workplace. The workplace, the boss. Should I tell my boss? Will they be understanding? If they don't, if I can't tell them, can I tell somebody in work? It's about, you know, can I get the pressure off work? in order to be there for times of appointments, and then when you need time off for your egg collection and transfer. So we'll have a look at that as well, you know. Okay, that brings me on to then self-esteem, the feelings that you have, you know, the feelings of guilt. This is my fault. It's my fault that we can't have a baby, and this could be for either partner. And we'll talk a bit about that, and feeling less of a person, like, you know, feeling less of a woman, feeling less of a man. Yeah, that's all those kind of feelings. That brings you on to lack of control as well, like the lack of control of what's happening. You know, in life, we normally are in control of everything we do, or mostly what we do, but it doesn't work with this, with fertility treatment. You work really, really hard of trying to make this work. You put everything in place you need to put in place, and then it doesn't work. And that goes against us, at who we are as people, I think, as humans. So we'll look at that as well. And that brings on a very important point to the isolation as well. You know, if we're not telling anybody, is it just about the two of us at home? You know, we can't go to that function, we can't go to that christening, we can't go to that party, because we're going to be asked questions. And then if we don't want to go, we'll talk about how do we get out of it, which is just as important. This is what I was talking about, the men versus women. With women, I think that we're kind of more expressive, and I'm up to being wrong here, that we like to, you know, we're hormone-based drugs we're taking, so our hormones can be a bit all over the place. So we get upset quite a bit. We show it a lot more. That's really what I'm saying. But with men, it doesn't always be like that. And I think what happens with men sometimes is that they feel they need to protect a partner. They're the ones going through everything. They're the ones that are going through this for me, for us. So they feel they have to be strong. And if they're having a bad day, they feel they can't show the bad day, especially if their partner's having a good day. So they hold on to a lot more, which can be very hard for the women, because then they think, okay, well, he's not saying anything, so he doesn't care, or it's, you know, he doesn't realize what I'm going through, and things like that. So we will talk about the relationship like that, and how you can sort of help each other and all that. Yeah. Okay, this is a nice little picture. Maybe I need to mow the lawn a bit more. I think it speaks for itself as well. So then we get on to the self-care. So with the communication. Now, the first thing to say is, what is your needs as a couple? You know, like what do you need from each other? What, you know, do you need somebody to listen to you? Do you need support from each other? Do you need time out without being together as well? Which I think all are very, very valid. It's probably the communication of talking about it. And I know you can feel like, oh God, we've talked about it so much, we just need a break. But then you just take a break from it. But it's when you know what your needs are. If it's like you're sitting down and talking about it, like if it's over dinner or anything that you feel that you want to do. So it's about the communication and meeting each other in the middle of what your needs are, when you can do that. You know, and it's appreciating what you're going through. As I said before, you know, you can minimize what you're feeling in ways and try to push it away and all that, but it is huge. It is something that you just really want together. You'd rather not be in the clinic doing this, but you're still glad to have the clinic. So it's all these emotions going on in your head and your heart. So it's being able to recognize that with each other. But it's important to have your breaks from each other. Like if one likes to go to the gym or goes for a run and the other one doesn't, it's being able to have that time away from each other as well. And that sort of brings me on then to family and friends. Family and friends, it can be hard. Again, we talked about, you know, do we tell them? Is it safe to tell them? Will they be looking at us and watching for questions or texting all the time? So it's looking at, you know, who is the safest person to tell? Isn't safe, I mean, like, will it meet my needs? I just want to talk about it when I want to talk about it, the fertility. So is there somebody there that I can do that with? You know, and family and friends can carry a lot of baggage as well. So, you know, like they might be not having a good day, or like maybe the sister is just about to have their baby, so you don't want to be putting your stuff on them. So it's about working out your needs and what's best for you as a couple, of who you tell and what you tell. Yeah. And like, as I said about the kind words, family and friends don't understand. Most friends and family don't understand what it's like to go through this. So it's hard for them to not say, look, just be positive. It'll all be clear. Look, you have a baby already. So, you should be too bad. Or look, just don't stress. So they're all very, very high emotional things to say, but they're just trying to help. But it doesn't actually help when you're going through something like this. Like the word positive, if we could just get rid of it in the fertility word, it'd be great, because it's just it's not a good word to have, because you are trying. You can't always be positive. You are doing the best you can with what you have, and you need to let the emotions out. You need to be upset when you need to be upset. And then it's about putting what's in place for yourself to help yourself to go through this. And we will talk a bit about that at the end as well. So then it's the workplace. The workplace can be a very pressurized place for a lot of couples. So it's looking at the whole big picture of the workplace. Okay, is the boss approachable? No, the boss is not approachable. Okay, is there anybody in work that is approachable that can help you out when you're in there? If it's to have appointments that you need to come into the clinic, can they cover you? If not, what is it about? Like, do you give so much information to the boss without telling them everything? Or is it a colleague? Do you just give them bits of information and not tell them anything? Or is it that you just go to your GP and get a sick note to say that you can't be at work for certain days or whatever, or take an annual leave? So it's with work, it can be a very difficult one, because it puts a lot of pressure on you. So you need to think about, okay, what do I need to give it less pressure on myself? Is it by just taking the whole time off because I can't change my workload, I can't change my position in work, or can I work from home a couple of days a week? And that can help, so it's looking at the whole big picture and what's best for yourself, and as a couple as well. So so that's that. Then you've got the coping skills, what your needs are in order to help yourself to get through this. Is it, for example, mindfulness? Is it like exercises? Is it having extra sleep, or being able to go to bed when you come home from work? Of course, these are a few little things like exercises and a bit of mindfulness, a bit of sleep, which can help. So it's looking at all that, like what do I need at the moment? What can help me be the way I need to be? Because it can be all very overwhelming, especially when you have an unsuccessful cycle, or you have a miscarriage, or any kind of loss within the fertility world. So it's about like, what do I need at the moment? What I often do with couples is that I break it down, because it's overwhelming and it's going all over the place in the head, and it's a roller coaster, and you don't know whether you're coming or going with what you're feeling. So it's trying to say, okay, where am I now? Where am I at now? What do I need now? It's breaking it up into little bits, little boxes. Okay, I'm devastated now. I'm so disappointed. I can't believe this has happened. So it's sitting with that. Okay, and letting yourself grieve with the loss. And as I said, it's like a bereavement, and anybody that's gone through a bereavement of family or a family member or whatever can maybe and hopefully recognize that it feels the same. So it needs to be treated like that. It needs to be treated as huge as it is. So so it's just doing that, and keep your breathing up, breathing all the time, putting anything that's you think that would be good for you to put in place, like yoga, walking, all those things. And now with the way COVID is, it's very hard to know what to do. You can't go for that acupuncture maybe, or to the yoga class, has to be all online, whatever. So it's bringing life back to simplicity of maybe it's that walk, or maybe it's having a dinner together, or maybe it's just going to bed and just crying and watching silly movies or something like that. It doesn't matter what it is or what you need, because everybody's different and everybody's an individual. So it's putting your needs first, needs with everybody. And I'll show a little slide at the end that I love, that I put together on the lack of pressures, putting less pressure on yourself for everything. So I suppose that brings you to me, the fertility counsellor. Our job is like, you've got somebody who understands, who's not part of the network of where you're coming from. I'm not a family member, I'm not a partner, I'm somebody that gets it and has a good understanding of what you're going through. So there's no judgment, there's no baggage or anything. You just come in and I just say, okay, this is what we're presented with, this is how you're feeling. Let's see how we can work this out best for you in order to move on, or to deal with it, you know. So it's kind of normalizing the feelings in a way, because you're not used to it. Do you know what I mean? You mightn't be used to these feelings. This is something different that you've ever gone through in your whole life. So you've never been faced with this. So it's like as if you feel you've changed in your personality. You've become somebody who's angry or upset all the time and cries, and you know, you just feel you're a burden to everybody. But you're very entitled to feel how you do in a way, because this is something huge. This is something you want. This is something you're dedicating this part of your life to. So you want to give it everything. You want to know that you're doing everything possible. So of course you're going to feel like that. Of course you're going to feel upset and the loss of if it doesn't work out for you. So you know, so it's to recognize that and to work on that, and that's how we can help you with that. And then it's like with there, I talk about techniques and coping skills. That's exactly what we're talking about, you know. And is it the walk? Is it the just lying down for an hour? Is it listen to a meditation app? Whatever it is, that's the best for you. Whatever works, and it mightn't work for other people, and that's okay. So this is the table. I just love this. I talk about this a lot. It's like you imagine a circle, and fertility treatment is in the middle, and this is where you're at. This is the most important thing that you want. So you really want this to work. You're dedicating this to, like, everything else has to work around it. So you've got that, and then you've got like family and friends, you've got the workplace, you've got all those social events and other things, which can be anything that you want it to be, that will that's out there. So it's putting everything around, all these things around the circle of fertility treatment in a place that can make it less pressurized for you to be in the treatment. Okay, so it's been, as I said earlier, it's having the family and friends that you can tell. If you can tell anybody. If you can't and you just have each other, well, then that's when I come in. I can help you to offload all that and to put it in a place where it needs to be. Same as social events. You know, if you feel I can't go there, I just can't face it, well, then don't go. You know, like, it's okay not to go. So it's putting yourselves first in what's best for you. You know, if you feel you have to go somewhere, you know, like just a party or just friends, and you've been avoiding them for so long, and now you feel, God, you have to go. So have something planned before you go. Walk in and say, God, I've had an awful headache today. But look, it seems to be okay now. But so it's great to be here. And then if you feel, oh my God, this is too much, the headache has come back, sorry, I have to go, I'm just not feeling great. And so you've already worked up the fact that you could have to go. So it's those kind of things. It's all those little care bits to put in place, you know. Yeah, so that's that. So conclusion already, we got there very quick. But the most important thing is understanding your needs, as I said. It's understanding what is best for you, what you need to put in place in order to help yourself through the whole process, you know. So yeah, that's it. And there's a lovely little picture of a nice little sleeping pair of cats that are looking after each other. So that's it. That's it. Thank you so much. And I know it went fairly quick, but I think I got my points across. So if I don't mind going on to questions now, if that is okay with you, Aoife.
Sorry, I was on mute. If you want to send in your questions into the Q&A box, I mean, I can go over, we did get some questions into Instagram, so I can kind of go through a few of those that came through, but you know, it'd be great to kind of maybe have a bit of a, you know, back and forth. So if there is queries or anything you like, please do pop them into the Q&A and I can read them out and we can kind of discuss them.
I have a few here actually that you have given me already, and I think there's a really important one here that I like, is how to mentally prepare for a life without children when you've tried all you can. And I think that's really, really important. You know, you've been on this road probably since you're God knows what age of, you know, get married, have kids and things like that. So you've always been on this road, and then you meet the partner you want and you want to have kids. So it's very, very hard to have to go onto another road. So it's about grieving it first. It's about coming to terms with where you're at, and then think about what is the next path you're going to be on. And it's a bit like the circle I did for the fertility treatment in a way. The circle of, think of that, of just like the void, or whichever word that you would put on, of not having children and not having children, what's going to happen. So it's about putting other things around that in order to help that. It's like nurturing that void and saying, okay, the void is probably will maybe be always there in some shape or form, but it's about how to nurture it and how to look after it, and putting things in place in your life in order to minimize it, get it smaller and smaller. Sometimes it'll be bigger than other days, but it's always going to be there. But it's just, as I say, nurturing it and looking after it, you know.
Fantastic.
Yeah.
There's a few questions coming in now, so I might just start reading them out.
Mm-hmm.
So just go with this one. One of the first ones. So, how to cope with a partner who doesn't support and doesn't want it as much as you?
Yeah, that's a really, really hard one. And I've come across that a bit. I usually find that talking to couples and to women when their partner, or vice versa, there's a fear there. There's a fear of not knowing what to do, you know, fear of something that it might have happened in their own lives, or that just a fear of commitment and being a parent. So it's about getting the support, you know, like I've seen couples for that fact of working through it and being able to work through, you know, like what that fear is. And sometimes the partners can't do that together, that they need another support in there, somebody that would know how to help them in it. And I would suggest it's the therapy. Do you know what I mean? Like coming to talk to a fertility counselor, or being able to communicate, like meet each other halfway, like listening to each other of what is the, like, why, you know, can he talk about it? And do they get defensive and can't talk about it? Do you know, the kind of way? So, you know, sometimes couples can get together and sort it out themselves like that. But more times I find that you need just a little bit of extra help, just to explore it a bit more and to see where it comes from, you know. But it's very hard. There's a lot of pressure on when one wants it more than the other, you know. I hope that answers the question. Okay.
Thanks, Helga. So this lady said she hasn't started IVF treatment, but she's wondering if fertility drugs have a big impact on mental health.
Well, they are hormone based, unfortunately. So we all know as women what hormones are like. So it can, again, it's how you are in yourself, what you need to put in place for yourself beforehand. You know, is it about putting things in place, you know, in order to get yourself ready, you know, for it. But they can have an effect. Some women have more effects than others, but again, it's appreciating what you're going through, appreciate what's happening. And it's okay to feel all those feelings, do you know, the kind of way. And with the drugs on top of that, well, then it can be a bit, but then you just get the support where you need it, or have people to talk to, and to understand that that's okay to feel like that, because that's all part of the process. But people are different in how they feel. Some get no effects at all of the drugs, and some get a little bit, some get a good bit. But the support is there no matter what you feel, you know.
Thanks, Helga. So I'm pregnant now, but have had a miscarriage before, and it has taken 2 years to happen. So I'm terrified it will happen again. How do I manage the first 12 weeks?
Think about how you were before. Is there anything different that you could do to help yourself? And I'm sure the answer is no, because you've given it everything, you've tried everything, you know, you've got as far as you did with the pregnancy as you did. So it's the hard thing with miscarriages, that it's so out of your hands, and again, it's that out of control. There's sometimes no reason why it happens. It's just happened. It was just not meant to be, which is so hard to hear, because the emotional impact that it does have. So it's about just, just embracing it, as best you can. You know what you're up against the second time, you see, and that can make it harder too, because you know the heartbreak and how hard that it feels to have to go through it. So again, it's getting the support out there and knowing what your needs are in order to help it, and know that you're doing everything possible to make that pregnancy work, and yeah. Mm-hmm.
Yeah. So there's another one here. I'd love to speak to others on this journey. Is there any other groups running?
Yeah.
I think NISIC do run groups, don't they?
NISIC do groups, yeah. They don't have the counsellor there on site when they're doing the groups. But yeah, they are there, and they talk about couples. It does all different couples there that talk about their experiences of what they're going through, whether it's donor or IVF. So they are a good group to have. It's something that I would love to look at in the clinics. Could we set up some kind of support group, no matter what way it is, just for couples that would like to talk to each other, but realizing that their journeys is different. Like, I know you can go online to all these different support groups, but it's knowing that your experience is different to everybody else, even if you have mirror image of issues of why you're on infertility. But I think you need to say, okay, that's their experience, but it's good to hear that, but it's not my experience, the kind of way. So it's giving it its place, but not letting it take over as such.
Exactly.
Yeah.
So how to deal with people you've told telling you that it's exciting to start your IVF journey when your heart is breaking, that you have to go down this route?
So can you sort of say that again? The first bit I missed. Sorry.
Yeah, she said how to deal with people that, you've told people that you're going to do IVF, and they're telling you how exciting it is that you're starting this journey, but your heart is actually breaking because you have to go down that journey.
Yeah, absolutely. And that's the roller coaster of emotions again coming up. You're very excited yourself to be able to do it, but you're glad it's there, but you hate because you have to do it. And you've got people around you who are saying, oh, great, you're going to have your baby out of this. Again, it's lack of understanding. People don't understand what it's like. So it's either choosing who you tell, that you don't have a big bunch of people and then you have to tell them about results or whatever like that. Or you're able to say, look, we're really delighted to be doing it. So it's explaining to them, but you are heartbroken that you have to do it. So it's picking and choosing, it's self-care again. Like who can I benefit from telling? Yeah. And and giving them, so then they are explaining to them if you're able to, of what it's like and what your needs are. Maybe like, look, I'll talk about it when I want to talk about it, if that's okay. So when I bring it up, it means I want to talk about it, the kind of way. But you can understand people that will get excited for you because they think it's going to, hey, this is the results, you're going to have your baby at the end of this. And they don't understand.
So this lady, she's like, what about health and well-being if choosing to start the process as a single person?
Yeah, that's again looking at what your needs are, like have you got a good support network around you? Do you need anybody around you? Because you have a lot more to think about, I suppose, like childcare and things like that afterwards, if you're successful. So, but it's about having things in place for yourself in order to be able to deal with the treatment and everything. And of course, the support is there. Again, if you need support around that, about going through the treatment and everything, if you have nobody there, or if you do have the chosen people that you choose. So that answers the question.
This lady saying, mentally do cycles get any easier? So if you're doing another cycle.
Well, you've got the fear of the unknown gone. Okay, so that's really the first. You've got a mixture of excitement and the fear of the unknown for the first cycle. So after that, you know what you're up against, which brings on its own things as well. Like sometimes some couples like to know that this is what I'm up against, so I know what to deal with. With second cycle as well, you might think, oh, I wouldn't actually do things that way. I don't need to take that time off work, or I will actually take that time off work, or, you know, that kind of way, or I definitely wouldn't tell as many people, or I would tell only that person, or maybe I will tell a few more people, you know. So it's all a matter of knowing what the first one was like in order to make differences if you need to for the second one. And when I say that, I don't mean it has any impact whether it worked or not, because it wouldn't have. It's just little changes to make it easy and take more pressure off you as a couple, you know.
Yeah, very good.
Yeah.
So this lady, she's debating whether to tell a close family member. It can seem easier to compartmentalize, and once it's out, it's out. Do you think it will make things harder or easier?
It all depends on you. It all depends on
Yeah.
that person. You know, can you have some kind of control over that? Again, what I said earlier, it's like, can you tell them, look, when I want to talk about it, I'll talk about it. That's okay. Otherwise, I just want to get on as normal. I want to feel part of everybody, you know, be normal like everybody else. So, you know, if that's possible with that person, you know, or look at it, are you just bursting to talk about it, bursting to tell somebody? You know, if what reason are you wanting to tell? If it's just, if you feel that you're just bursting to tell somebody that, well, use me in the unit, you know, like we can talk about it and you can get it all out there, because it's information and it's feelings and emotions that you can't hold on to. Do you know what I mean? You have to let them out at some stage, just, you know. So it's looking at all that, looking at who the person is, what your needs are for telling that person. Yeah.
Yeah. So this lady's asking, can you discuss further about proving your self-esteem? Going through IVF and miscarriage has changed me as a person. I'm not as outgoing as I was. I've become quieter. I feel judged and worry what others are thinking of me. I'm active. I run. I go to boot camp. I'm happy at work, but I know myself. I'm not the same person.
Yeah. And that happens with everything in life, really. Experience changes who we are. And you know, again, it's like going back to the little void that it's like left on you. Do you know what I mean? And it's nurturing that and looking after that, you know, that grief and loss. And that change in you, you know, it's like accepting, okay, this has happened and this has changed me in these different ways. So what do I need to put in place to nourish that and to look after myself with that? You know, like, what can I put in place? You know, I know you're doing the running and the walking and you're doing all those exercises and you're doing everything, but it's looking at all the emotional impact that it's had on you and all those feelings you have. And, you know, I don't know if they're all going mad around your head, or, you know, is it overwhelming? And maybe it just all needs to be sorted out, like a map of your emotions, and putting them all out there and looking at them all and saying, okay, I'm going to start off with that one. What do I need to do to help that part and help this part? That kind of thing, you know. So it's maybe that's the case of doing it, but it does change you. Everything changes you. Every experience that it does change you. So, but, you know, it's if you nurture it enough, your old happy self will come back. Do you know what I mean? In some kind of form, because that's part of who you are. It's part of your DNA. It hasn't just gone and left your body. It's hidden a bit at the moment because you're suffering and with the loss, which is totally understandable. You know, again, it's appreciating what you're going through. You know, it's hard.
Yeah, that's helpful. How do you help family to understand the difficulty of what you're going through?
Yes. How do you help family? Well, first of all, it's trying to, I suppose they can't understand because they don't get it. So it's, again, start off with maybe the kind words, you know, when they say things to you that they think it's helpful, but it's not, and you just want to snap their head off. So it's a sitting down explaining how difficult it is to go through this. And I think the grief and loss bit and the bereavement bit might help, because families and friends and people around you, and I've seen it personally as well with some people in my family, is that, oh, she should be over that now. Why isn't she getting on with it? That's she had her miscarriage, or she had her thing, you know, because there's nothing to show for it, and because there's nothing there, they feel that the emotional should be gone as well. But that doesn't, because that stays with you. Your body has gone through the grief as well. Your body had life there and then it was gone. So your body feels that life gone as well. So it's explaining to them maybe what it's like to have to go through that, and the thing that it's the loss of the potential. It could help that way to sort of to talk a bit about that. But it's, it's a hard one, because they don't understand, and it's no fault of their own why they don't. It's just because they haven't experienced it. Yeah.
In a case of unexplained infertility, how do you stay positive after previous failed transfers?
Yeah, I think that's such a hard one, unexplained, because nobody can tell you it's because of this, so it's, so we're going to fix that and then it'll all be better. It's not like that. So it's about, how do you deal with it? What do you need to put in place for that? Isn't that the question? Isn't that what you asked me? Sorry, tell me again what you asked me. Sorry, Aoife.
No, you're going to just go back. In the case of unexplained, how do you stay positive after previous failed transfers?
Yeah. Well, first of all, again, we come back to the positive word. If you don't feel positive, well, then don't feel positive for the time that you need to not feel positive. It can be stressful. Try not to be stressful. So you need to just be able to go with it and to appreciate what you're going through. And unexplained, as I said, is hard because nobody can give you a reason. Nobody can tell you, and you're probably hearing for the medical team, it's because it's true. It can happen anytime. So you're waiting on this happening anytime bit, and it's not happening. So it's just medically, there's no reason why it's not working. And so that's in itself hard to deal with. So it's appreciating that, and again, putting your needs in place of what you need to help yourself through it. It's a difficult one.
How to decide when to finish, even when there's embryos left from earlier cycles, because it's so hard to keep going emotionally and financially.
Yeah, that's a really hard one. First of all, I'd say give yourself time, away from the clinic, away from, first of all, you need a break. You need a break from treatment. Your body needs a break. Your mind needs a break. So it's getting that break first, and before you make any decision. But I know finances can come into it a lot. That will decide. So again, it's the grieving process. It's trying to come to terms with that. Okay, I can't use them. That's left, and how am I going to deal with that? So it's again processing it, looking at it, getting the support needed. I often find talking to couples like that about that, and I think time out is definitely a first thing. Of you don't know what 6 months down the road will mean. Like finances could come together if that's the reason. For your own body and your own mind, it's about giving that time to be in a place that you can make a decision, whether like a constructive decision on, yes, that's my body's back to normal, my mind is in some kind of state, but no, I couldn't go through that again. So then it's looking at that and going through the process of grief and loss, and looking at the best you can.
Very good. We are 1 week today past a failed FET attempt, had numerous failed attempts over 15 years. What would be your top 3 coping strategies?
For failed, say that again, the start of again. I missed the start of the sentence.
We're 1 week past a failed FET attempt, frozen embryo transfer, had a numerous failed attempts over 15 years. So they're just asking what your top 3 coping strategies for kind of dealing with this loss would be.
It's as I said before, it's facing the loss. It's appreciating for what it is. It's looking at what are my needs, what do I need to put in place in order to help myself at this minute in time. So you deal with where you're at that minute. You've gone through a lot. Your body's gone through a lot. So I'd say, it's first of all, it's going through the grief and loss process. Okay, letting yourself express it, let yourselves together as a couple, being able to say, I am really, really hurting here, talking about the future, all that kind of thing. Other coping strategies like, looking after the body, appreciate what your body's done. What is, putting like health stuff, like walking, all that kind of thing. Feeling I'm saying freedom, but I don't mean like freedom. I mean just putting a little something in place in order to give your body a break and your mind a break. Which is best.
Have you any advice for addressing intrusive questions by curious family friends on IVF?
Yeah. Again, that's the question around what you tell your family. Make it on your terms. This is where your control comes in. Like, as we talked before, the lack of control with it all. So where is my control? Your control is like what you tell people. And if you tell your whole family everything about it, have it that, I'll talk about it when I need to talk about it. That's okay. Because I don't always want to talk about it. I want to feel that I can get out and enjoy myself and not have to worry. So family and friends should totally understand that. And it's okay to say, I really don't want to talk about that now, if that's okay. So it's you taking the control. You get in there before they get in there, as such, of what way you want it to be, so they don't come in with all the questions and, like, as we talked before, the kind words,
Exactly.
Yeah.
Would you recommend taking time off during treatment, and if so, for how long?
Again, it's looking at your work, where you work, what you do. Is it really, really pressurized? Is it really, really busy? So first of all, can you change your role for the time you're on the cycle? Can you, is your boss approachable, that you can sort of say, listen, I need to take time off, and not tell him anything, just say it's medical stuff? Or can you tell him everything? If that's not possible, again, it's back to the pressure of work, the pressure of all the pressures around you. So it's about like what you need to put in place. If it's just too stressful, when you're there, some jobs, when you're there, you're there. So you can't do, and you're full in, you're lifting, pulling, dragging, whatever it is. So then I would look at, okay, this is everything to us at the moment. We want to give this everything. We don't want to have any regrets. We want to know that we've given this chance, the biggest chance ever that we can give. So if work interferes with that, or you feel that it's really, really stressful, you can't work from home or anything like that, well, then I would look at it. But you also have to look at, you're at home then doing nothing. So it's kind of like, is a day going to feel like a week or a month? So it's actually looking at the whole big picture of being at home, not at home. Some women come and say, no, I'd have to be in work. It'd drive me mad to be at home, especially the 2-week wait. I need to take time. I need to be in work. But their job could be sitting at a computer, not being in touch with anybody, and just being able to get on with the work, or some women can change their role for the few weeks or whatever. So it's really looking at the big picture. And as I say, GPs are great. GPs will give you a cert for whatever you want. A lot of women that do work and everything would really take time off around the egg collection, just be, and then you need to, because you're under sedation and anesthetic, you go home and you have to be looked after that night and maybe the next day. So some women, if they're taking time off, would take it around that time. And then you've got the transfer. So it's maybe after transfer, just taking a day or two off just to let things settle down and then get back to normal. So it's looking at all the stuff that's happening around you, what you're able to do. But at the end of the day, you need to know that you've given it everything. Have no regrets about what you did with this, when you're on the cycle, as best you can do. Do you know what I mean? Because you're passing the medical stuff over to doctors. Doctors are looking after all that. So what you're in charge of is yourself and how you are in your self-care. So it's looking at the big picture. It's not a question you can kind of just say, do this, do that. It all depends on the individual and where you work, and
Yeah, definitely. The next question is kind of more, and I think it kind of just again feeds into the whole Be Kind with Your Words campaign. It's just some people say some people look down on women without children, and have sometimes very hurtful remarks. It adds even more pressure. How to cope with such social pressure?
Yeah, I know. And in an Irish society, it's all about, as I said earlier on, getting married, having the kids or whatever. And it's not like that. And some women can be seen as selfish for not having children. God, that kind of way. So, which is very, very hard. So again, it's having something, for somebody that says anything to you, it's having something in your head that you would like to say to dismiss it or whatever. Do you know what I mean? Like, start off with that. So your self-care starts off with like, okay, I'm meeting this person today and I know they're going to ask me something. So have something rehearsed, have something prepared to cut it off, do you know, the kind of way. But also, I suppose you have your own emotional impact because you're still getting used to maybe not having children, if that's the case. So again, it's nurturing that void that's left there. and putting everything in place what's best for you in order to deal with all this kind of thing. And everybody's needs are different.
Definitely.
Yeah.
Yeah. No, 100%. How would you tell people you're choosing to be a single mother via IVF?
Yeah. Again, it all depends where you're from, what your family are like. You know, it's so out there now, the amount of single women having children, single, you know, single parent,
So common.
it's hugely common, as we know,
Yeah.
you know, like we see it all the time. So you'll be surprised at there's less of a thing about it now. As I say to women that come in, like, I guarantee that potential child, if you're successful, will go to school and there could be 3 or 4 in their class conceived the same way through single parenting. So it's not a big taboo. So it's about then telling the child, I suppose, if that's okay to go into that. I don't know if anybody has any questions, but you know, if a child grows up, this would say telling the child versus not telling the child, and that can help in order for the mum to cope with being a single mum then as well, or you know, with people around them. So it's looking at all the big picture, you know, of everybody. Can you tell people? Can you tell your parents? Can you tell your friends? How will they take it? You know, but really, friends and family, I suppose it'd be lovely to know that they would support you no matter what you try to do or what you wanted to do, you know.
Yeah. How would you deal with a situation where your partner is ready to stop trying before you are?
Yeah, that's a good question. It's really the communication. It's weighing up, you know, like why is your partner want to stop now? Does he sometimes? It can be very hard, especially for the male partners, to see their female partners upset. It's like what I was talking earlier on with the male versus female. They just find it hard. It's like as if their partner's got this personality transplant. They're just crying and upset all the time, and they don't know what's up with them. So they're fearful of that. They're fearful of what will happen to their partner, because sometimes female partner is a strong person, you know, the kind of way, and they don't understand what's happening. They don't understand why they're feeling the way they are, so they feel that they mightn't cope with it. So it's looking at why that partner doesn't want to go forward with a cycle. And it can be the same for the female partner. They just had enough. They just can't do it. Their body, the intake in the body, the whole is just, I can't do this anymore. And the male partner thinks, well, let's try one more time, you know, because they haven't probably gone through all the impact that they have. So it's coming to terms with that. It's coming, meeting in the middle and looking at and weighing it all up, and maybe doing the 0 out of 10 and 1 out of 10. Why do you want to go again? And 0 to 10, why do you not want to go again? So it's measuring it up the best way you can, and then coming to conclusion. And then if you can't, if you find it still hard, then you come to me and I'll help you. If you're in the sorry.
This lady's asking, would you recommend counselling?
Oh yes, of course. Yeah, absolutely. Yeah, there's no doubt about it, because I can only talk for myself, I suppose, but being a fertility counsellor and working in the field so long, it just gives you an insight. I lay everything out. I turn all the stones, so you know exactly what you can be up against. Everybody's different and everybody's experiences are different, but it's to let you know that what you're feeling is normal. It's okay to feel this sudden deep sadness, this regret, this personality change that you think you've had, because you know, you can minimize the feelings of it, you know, and everything. So yeah, I would definitely recommend we can look at all that and go through everything with you and support you through that. Sometimes it's just offloading and letting it all out. If it's a bit of a cry or just letting it all out with verbal words, is it good enough? Is enough to do. Yeah. So, you know, so yes, I definitely recommend it. Definitely. For that alone, you don't have to think that you're mad or there's something up with you because you come to counselling. It's not like that at all. It's a support, it's offloading, it's letting you know that it's okay to feel like that. That's what our job is. Yeah.
So how do you feel, how do you deal with feelings of guilt when you can't give your husband the family you know he longs for?
Yeah, and that is the hard one, and that is something that you do get faced with a lot. And it's again communicating and being able to tell your husband that you feel like this, that you feel that it's your fault and why can't it work. And a lot of women have come in and said, I've even told him to go and meet somebody else, you know, but it's really, it's both of yous in this, you know what I mean? You just can't do it without each other. Yous are together for a reason. You know, think back to where you met, you know, where you got together, you got married, you didn't get married, whatever. Just all those early days of why you are together and why you wanted to have this baby, because you wanted to have it together. You didn't want to have it apart. Do you know what I mean? You just wanted to have it together, and talking about that guilt and working it out that way as best you can, you know.
Yeah. No, definitely. This one's actually quite relevant. So, how do you make counselling sessions work at the moment regarding COVID?
Yeah.
Is there an option for in-person counselling?
Yeah, at the minute, there's not. It's all Zoom and phone calls. And we were actually talking about that, Eve, earlier on, how it actually works quite well. Now, face to face is always better. The room at the minute in the rotunda is not really great for that, but it could be. We could get another room available. Do you know, the kind of way, if that was the case. But it's actually surprising how well I can connect with people on the phone or through Zoom, that it actually quite works. But yeah, as I say, face to face is best, but it actually is working quite well the way we're doing it at the moment, you know. So it's, you know, so it's, I think it's a matter of getting used to it, isn't it? It's a matter of getting, because I was wondering about at the start how we're going to get this to work, but it actually does work.
Yeah, so we're all using Zoom now anyway, so it's
that's it.
So there are two questions from this lady. She's like, any tips and strategies on how to cope with other people's pregnancy announcements, which I think is actually, you know, a really good question and comes up quite a lot. And then how to give tips on how to normalize conversation around treatment. She's a single person trying to become a mother, and she's very open as it helps. And she's also, she's very open to, you know, opening up the conversation around assisted reproduction and versus second choice parenthood. How can I best deal with negative feedback is what she's asking, I suppose. And also those pregnancy announcements, those are really tough, I think, and we get that so much in people's, you know, that it's really difficult for people to see close friends and families with those constant on Facebook, on Instagram. It's just there, you know, and it is quite tough to look at.
Even ads on the TV, like it's everywhere, absolutely everywhere. And again, it's taking your control back, you know, because it's always going to be there. You can't get away from that. So it's putting in place what's best for you. It's like, you know, I was actually talking to one girl there a while back, and they planned to tell her that her friend was pregnant. So they made a big deal all around her in order to be able to tell her. And even though she appreciated that they were trying to look after her, she said, oh my God, it was such a big deal. Why can't I be just like anybody else and just tell me? And I'm going to be upset. It's going to happen, but I have to be told. So people can feel very different and very not part of the norm because people are not telling in just like, you know, so it's about controlling it yourself and even seeing people that are pregnant. You know, can you face going to that christening? Can you face doing that or whatever's in place? So it's again looking at your own needs and what can I put in place in order to go there. And if I just can't for that one, it doesn't mean you're not always going to be able to go to these things, you know. So it's again, it's if you can try and control the situation, you know, for yourself, in order to put your needs first and not just throw yourself into it and then think, oh God, I can't get out of here. I need to get out of here. So, you know, what was the other part of the question?
It was just some more about dealing with I kind of to give tips on how to normalize conversations around treatment and dealing with the negative feedback. And
I think that's again, it's you being in control of it, you telling people what your needs are, of what you need from them. And if somebody is negative about going for treatment and saying, God, why would you want to be a single mother, or things like that, which you probably would hear, and just saying, well, I'm me and you're you, and you know, it's having your answer ready for it. You know, the kind of way to stop it, to sort of nip it in the bud before it's being prepared. That's it. It's just being prepared again.
No, I think we've got through a lot of the questions here, and there's some other ones that we can kind of answer offline as well. But there was just kind of one last one there, kind of just about feeling, again, just feeling of like a failure and feeling like less of a woman, you know, and how to kind of deal with that during fertility treatment. I think that's come up a few times.
Yeah. And it's about, like, you know, and when you're feeling less of a woman like that, you can also blame your body and say, my body's let me down, it's such a failure and all that. But yet our bodies are made for this. They're made to have children. So your body's actually working very hard, you know, to make this happen. So it's appreciating that, and being able to think, you know, okay, again, these are both in it together. Do you know what I mean? That, you know, you're feeling less of a woman, but your body's actually working really, really, really hard in order to make this work. And again, it's putting all your needs in place and nourishing that. It's looking after yourself and that. And, you know, it's looking after the body, looking after the mind, and saying, I know you're working hard at this. I know that you're trying your best, you know. And, you know, because, you know, and I think that will help you come to terms that you're no less a woman than anybody else, you know, but it's hard. It's hard.
I think just being kind to yourself is really, really the important thing.
Yeah.
You know, just don't be so hard, you know, doing your best. I think there's one last question in there just about how to deal with friends' suggestion to move to donor when it's not for you. I assume if she means donor egg.
Yeah, I think that's it. Like, you know, when you go from the different phases and steps of going through treatment, first of all, you're trying at home for an amount of time, and then you go to the big step of coming to the clinic and getting investigated, and then you go to the big decision of having treatment done, and then that's where some people stop. Okay, and then some people don't stop, but when you get to the point of when, okay, they talk about donor, like medically, if they talk about donor, that's a huge step forward. So it's about, you need to sit where you're at the moment. And, you know, again, family and friends, they don't understand, they don't get what a huge step. They think, oh, just go for donor and then you'll be pregnant and that's grand, then you'll be happy forever after. That's it, you know, but it's not like that, as we know. So it's about letting people around you that are important enough to you to know and to understand what it feels like to have to make those decisions. Do you know what I mean? And appreciate and sit with it. I wouldn't rush into any kind of decision of donor until you sit with it, because sometimes it can be a surprise. Sometimes people get time to get used to the idea and they're ready. Yeah, this is just a natural progression. But if it's a surprise and you're not expecting it or anything, that I would just sit with it and just let it all soak in, get all the advice, get all the counselling input as well, is what we would deal with as well, on what you're up against emotionally every way, and then make your decision. Have all your information there in place. But yes, with family and friends, they just don't get it. So it's about just, you know, explaining, give them an understanding, or, you know, and with people that you tell, it's looking at the people you do tell, you know, that can come back with questions like that. You know, and you can learn a lot from that, from a first cycle to a second cycle. You think, oh my God, I'm not going to tell them that I went through it. I had to text every day, where are you at now? Or, well, I hope you're okay, and all that. So you learn a lot as you go along, you know.
Definitely, yeah. Now, I think we're kind of coming up to that time. So thank you so much, Helga, and thank you to everyone that's turned up today. It was fantastic. And thank you for all asking your questions. You can, if you've any, like there was a few there that are we can answer offline, that are a little bit more personal. And if you have any other queries, you can send them into communications@sims.ie, and I'll happily pass them on to Helga. And so just thank you again. Thanks so much for popping on, and thank you, Helga.
Yeah, no problem. Thanks a lot. Thank you.
Bye, guys.
Okay.
Bye.
Bye. Bye. Bye. Bye. Bye.